This definitely wasn't on my radar at all.
This skin disease was historically difficult to treat, and it usually took an average of 10 weeks of daily oral ivermectin to achieve remission.
This is an incredible case, and that seems like a medical breakthrough.
Because of the breed of the patient, it was not safe to use ivermectin. I decided that this was a great opportunity to treat my first case and prescribed a single dose of oral ferreliner. And when I saw Kenny for subsequent rechecks, I was astonished. It worked, and it was really well tolerated.
Working miracles in the derm office.
Yeah, exactly.
That is such a cute dog, by the way.
Yeah, not a drastic for sure.
His owners must have been so happy.
They're pretty happy, yeah. Since that first case, obviously, this class of drugs have become our go-to option for treatment of parasites in dogs and cats.
Wow, I think this is going to be really good for other veterinarians to know, too. Today we have a very special guest, Dr. Vincent Defalque. He is a Board Certified Veterinary Dermatologist at Northwest Veterinary Dermatology Services in Vancouver, British Columbia. Can you tell us about any cases that come to mind that are some of your most memorable or inspiring cases? I bet they have to be pretty memorable. Skin stuff is so graphic.
It's a paper I just published in the CVJ a few months ago, like in November, I think. And it's about Isoxazolines, and that's an area of interest of mine because I like parasites.
Oh, wow. So this is one of your actual patients, and it's been published. Okay, great.
And it's kind of, that's definitely my most memorable case because I was like,
whoa. Yeah. What happened with this little guy?
So we all have patients that we'll always remember, and that's certainly the case with a patient of mine that I saw in the fall of 2015. And this was a 6-month-old Australian Shepherd puppy called Kenny. And Kenny had demodecosis, which is a common skin disease caused by the proliferation of a mite called demodex. And the lesions were on his face, as you can see on the photo.
Yeah.
And he also had a severe secondary bacterial infection caused by an antibiotic-resistant staphylococcus.
Oh.
And because of the skin infection, the poor puppy was really itchy, and he had to wear an Elizabethan collar 24/7. But because of the age and the breed of the patient, it was not safe to use the classic treatment at the time, which consisted of oral ivermectin. But a new class of anti-parasitic veterinary drugs called Isoxazolines had recently become available in Canada.
Wow.
And at the time, these drugs were only labeled for the treatment of fleas and ticks, but there was some early scientific evidence for extra-label use for the treatment of demodex mites. So I must admit, I was skeptical at first about the fact that these new medications would lead to a cure, because this skin disease was historically difficult to treat, and it usually took an average of 10 weeks of daily oral ivermectin to achieve remission. But I decided that this was a great opportunity to treat my first case, and we prescribed a single dose of oral ferreliner, which is one of the Isoxazolines. And then when I saw Kenny for subsequent rechecks, I was astonished. It worked, and it was really well tolerated. And you can see that that's just a single dose of ferreliner.
There are variations within certain breeds. Some breeds are prone to a genetic defect. Commonly used medications like ivermectin can lead to neurologic signs, seizures, blindness, and death. We see dogs for ivermectin intoxication. They access livestock dewormers out on the farm. And so it's important to be super careful. This is an incredible case, and that seems like a medical breakthrough. This definitely wasn't on my radar at all.
Since that first case, obviously, this class of drugs have become our go-to option for treatment of parasites in dogs and cats.
Wow. I think this is going to be really good for other veterinarians to know, too. There are situations where you can't reach for your first-line drugs, or when you might not be getting the results that you want. So is this something that should be administered only under the supervision of a board-certified veterinary dermatologist? Or
no, any veterinarian, however, those are prescribing drugs.
Oh, that's very interesting. Well, that is amazing. Thank you so much for sharing. So I will put the link to this article, which was published in the Canadian Veterinary Journal, in the description, so people can check it out.
Thank you.
Awesome. Okay, should we move on to a next question?
Yeah, so this...
So he's such a cute dog, by the way.
Yeah, that's drastic.
His owners must have been so happy.
They're pretty happy, yeah.
Working miracles in the derm office.
Yeah, exactly.